Physicians need telehealth to stay connected with their patients during COVID-19. Learn how on this week's Medical Economics Pulse.
As we know, at least certainly now during the public health emergency, that it's become necessary for many practices to make the jump in order to continue to have a stream of revenue, and that many payers have indeed relaxed and extended the types of visits that they reimburse. So all I can say is it's an unfortunate time to find ourselves in a pandemic situation, but we shouldn't lose connection to our patients, and we should jump in and use telemedicine to do so.
As physicians deal with financial struggles from the COVID-19 pandemic, telehealth is serving as a lifeline. Virtual visits are allowing physicians to treat their patients and retain a revenue stream during these difficult times. But getting started with telehealth can be a daunting challenge. Today, we are joined by Dr. Tabassum Salam, the Vice President of Medical Education at the American College of Physicians. She's going to discuss how physicians can get started with telehealth. Dr. Salam, thanks so much for joining us today.
My pleasure.
So the first question, just really basic, how do you define telehealth? What is sort of the best working definition for physicians for telehealth?
So there's a lot of definitions being used out there. Telehealth, telemedicine, sometimes the terms get used interchangeably, and it can lead to a little bit of confusion. So I think in general what you'll find is telehealth is the broader umbrella term. It refers to using electronic communications methods to deliver healthcare to patients. Telehealth, being the broader term, encompasses telemedicine, which we'll talk about in a second, mHealth, which, for example, is a way to deliver health information to patients, as well as remote patient monitoring, the way to record biologic measures at home and deliver them to, say, a physician who might make an intervention based on them. Telemedicine in particular is usually reserved to refer to synchronous and asynchronous direct patient care delivery. When you say synchronous, most people refer to video conferencing between, say, a physician and his or her patient.
Okay, great. Thanks for clearing all that up. Obviously, right now, the context that we're conducting this interview about is with the COVID-19 pandemic. And could you kind of go through some of the sort of the main reasons right now, the main ways in which internists or other physicians would be using telehealth, telemedicine with their patients? Can you just do a quick survey of those?
Certainly. We're in an unfortunate situation with the national health emergency due to the coronavirus pandemic. But physicians can feel a little bit reassured, actually substantially reassured, that they can still provide access to their patients by utilizing telemedicine. And I know that for many patients who are able to use the service, it brings them a lot of relief to be able to connect with their regular doctor. It's great because patients aren't allowed to get out and about. It's safer for them to stay at home. And likewise for their physicians, it's safer for them to stay at home too, but to be able to continue to give them care. Patients can access their physicians through telemedicine for acute concerns. Certainly right now, many people are worried about themselves with respect to coronavirus, so they can get their questions answered, have some symptoms discussed, and get some sort of triage assessment as to whether they need to escalate the need for care to in-person care. But certainly one has to remember that their care for ongoing chronic diseases shouldn't be abandoned either. And this is a great opportunity for their regular physicians, primary care and subspecialty physicians to use telemedicine to continue to give them guidance on how to manage chronic diseases. For example, diabetes, high blood pressure, common ones that they don't stop needing care in these emergency situations.
Great. the next question is, we've been reading a ton about how the federal government and the states are loosening restrictions, loosening regulations on telehealth, telemedicine. Can you talk through I know that they're very rapidly changing. Can you talk through some of the basics of how the regulations have quote unquote loosened?
It's a great adjustment, and it's wonderful that both federal and state level regulations are being loosened and relaxed to respond to the emergency that's happening right now. There are several categories, and you're right, they're evolving almost daily, but some broad generalizations. Let's start with licensure. Several states have relaxed the requirement that a physician or a few other categories of healthcare providers must be licensed in their state to provide care to patients residing in their state. It is at a state level, so every practitioner is advised to check the state requirements, but be assured that well over 20 plus, maybe 30 plus states at this point have taken these relaxations into account. Another big advantage in this period is an overall ease in the rigidity of choosing a telemedicine platform that is strictly HIPAA compliant. You know, you don't want to throw caution to the wind. You do definitely want to keep patient security and cybersecurity in mind when you're choosing a platform with which to reach out to your patient. But at least right now, if you're a physician or a practice hoping to get started in a emergent manner, you're able to choose more commonplace solutions like Zoom or Skype, which you weren't able to do before this emergency period of time. In addition, several payers, including Medicare, have relaxed requirements of patient location. Prior to this emergency, for example, Medicare, patients had to be in certain locations, such as certain offices. Or if they were to receive telemedicine care from home, they had to live in rural areas. Several of those requirements have been restricted, making it very feasible for physicians and patients in rural, urban, or other areas to reach out to each other and use telemedicine for their care. And several reimbursement relaxations have happened, meaning that the spectrum of types of care and types of patients to whom care can be given has grown, which has made it feasible for more physicians and practices to introduce telemedicine in their everyday care of their patients.
You know, obviously it's impossible to predict the future with this, but is there any kind of advice you have for physicians that maybe are taking advantage of sort of this more relaxed state? At some point, the pandemic will end, and the assumption is the rules will come back. You know, how do you sort of navigate between, you know, doing what you need to now during the pandemic to treat your patients versus sort of having an established telehealth program that you can use going forward? You know, what kind of advice would you give for sort of navigating that transition?
Well, I'd say the biggest thing that we should take away from this is just by the sheer environment that we find ourselves in, many physicians and patients have taken the leap and crossed that barrier into telemedicine. And both sides are realizing this is very feasible and has so many positive aspects that it brings to their delivery and receipt of healthcare. I would like to see that enthusiasm carry over as we emerge back into a state of normalcy. And I would like to hear those voices raised to advocate for making telemedicine a wonderful asset in the way that we deliver healthcare in America. It will never replace the need and importance of in-person care, but it's a wonderful ancillary method in which to extend our reach to our patients, either because of geography or the dimension of time and the inconvenience that in-person visits might sometimes create. So I'd really like to hear the voices and energy of physicians, other healthcare providers, practices, patients, and payers, I would like to think, join in unison to make this a more standard part of American healthcare going forward.
So let's a scenario for, a lot of physicians, like we said, like they were using telehealth, but there's a number of them that didn't want to touch this stuff. And I'm wondering, right now you're like, my practice is, I need to see my patients and I need to use telehealth. Can you kind of give a basic kind of crash course in like, okay, what do you need to do to like start from ground zero to actually being able to connect via video with a patient with diabetes to talk over, what they need to do? Like, how do you kind of set that up really quickly?
There are simple ways, and as since so many regulations have been eased, now's a great time to jump in. The first thing you want to do as a practice leader, physician leader in a practice, is gather your team. Make sure that you, your fellow physicians, other healthcare providers, and your administrative team are on board, because everyone's going to need to participate to make this happen. Work out a workflow with your office staff. They know the everyday in-person care workflow very, very well, and have them work with you to brainstorm the easiest way to switch that out to introduce telemedicine. There are some natural areas in which the transition is easiest. So, for example, sit down and script out a message that your telephone receptionist can use when patients are calling in. The words that they can use to invite patients to make the switch to telemedicine. Words that are reassuring and will let the patients know that you will be there to support them, especially about the technical transition, so patients can feel comfortable making the change. Talk to your scheduling staff about how you want to adjust your scheduling calendar. Usually it's a small matter of just adding perhaps the letters TM to the end of a patient's name on the schedule, so everyone knows that's a telemedicine visit. You will want to choose a telemedicine platform. And in this emergency period, when many of the HIPAA regulations have been eased, perhaps you should choose a simple platform. Just go with commercial Zoom, go with Skype. If you would like to look into some of the formal telemedicine vendors, please do so. They're all ready and waiting. They will show you the easiest way to get started. And then you will want to get the message out to your patients that you are up and running on telemedicine. Obviously, when patients call in to inquire about receiving care, your staff is ready to tell them. You should sit down with your staff and look at a list of the patients that have been scheduled for visits in the coming months, and call each of those patients one by one and tell them that you don't want to cancel the visit, you just want to convert it to telemedicine. In addition, you should create a easy how-to guide for your patients. Once you've chosen the platform you're going with, from a user's perspective, an easy guide how they should log on, how they should configure their webcam if we're going to be using a webcam. Remind them that they should choose a quiet, private, secure location from which to engage in the visit so that they are indeed able to maintain their privacy. And reassure them that just in case the video conferencing aspect doesn't quite work out, there's always good old-fashioned telephone, and that both sides can revert to that if they need to and still get a lot of care delivered.
Great. So obviously we talked a little bit about equipment. In terms of like the patient end, I imagine a lot of patients feel comfortable with technology. A lot of patients maybe don't. Obviously, providing a guide is great, but what can you do for those patients? In some ways, maybe the patients who you'll need to talk to the most, maybe the least comfortable with technology. So how do you sort of navigate maybe that technology understanding gap? Is there a role for families or caregivers in this kind of exchange? Can you kind of talk through that a little bit?
So absolutely, we have an overwhelming sense of responsibility to make sure that we can give fair and equitable access to healthcare to everybody. Every physician will tell you that they're very concerned that the video conferencing platform might just be a step too far for many of their patients. So the first thing I want to caution everyone about, though, is make no assumptions. It's amazing how tech savvy all of us have become. And certainly in the last month or so, many of us have pushed our boundaries and been pleasantly surprised by how much more we're able to accomplish. Many a time I hear the concern that perhaps an older patient may not be able to utilize the video conferencing platform, but I personally have been very humbled by the sheer number of patients of any age group who have who are using video conferencing very well. So ask your patient if they are using FaceTime to check in with their own loved ones, then they're probably set. If they have a smartphone, they are probably going to be able to make the transition comfortably. And as you mentioned, and if they haven't quite made the jump themselves, this is a great time for them to reach out to family or other local support who might be able to pop over and configure their device for the platform that you're choosing for the medical care. And just reassure patients in this for the small fraction for whom none of this will be feasible, there is telephone.
Okay, great. In terms of the clinical staff and who can and should be involved in telehealth, what's sort of the role for physicians versus the role for a non-physician provider, such as a physician assistant or nurse practitioner? I'm not sure what the rules are in regards to which types of providers can actually do a consultation via telehealth. Can you kind of talk through that a little bit?
So the bottom line is everyone can do a consultation through telemedicine. I think a big part of what we're discussing is which healthcare providers' care is reimbursable. It does vary by payer, but there's been a lot of relaxation and extension in the last few weeks. So I encourage every practice to look into their various payer types and investigate where the options for reimbursement have been extended. It is wonderful to be able to include multiple members of an interprofessional team in the care of your patients. Just as you might do in the office, where you have your nurse practitioner come in or substitute for a physician for several visits, where nurses play an integral role in patient education, where perhaps a nurse case manager or social worker steps in to support patients with many of their social needs. There's no reason why that should stop. It'll just be managed through the video conferencing platform, where you can bring in the other members of your team to complement the clinical leaders' care in a interaction. Many a time, for example, behavioral health therapy care is done between a patient and their therapist with one-on-one. Physicians need not be involved in those meetings. And they're very highly valued by those patients because it gives them a sense of privacy, ongoing connectivity with their therapist. Really, telemedicine should be looked at as just another medium in which to deliver care.
Okay, great. In terms of, we've obviously talked about some of the really simple ways you can get started with telehealth, but if your practice wants to sort of jump to hiring, a professional telehealth vendor, third party, what are the benefits of that? And then what are some of the things you need to look out to, sort of the buyer beware things when you're evaluating a potential third party vendor?
There are many vendors out there, and they're all, most of them have much of the same basic attributes, of course, that are necessary for telemedicine. I think a good starting point is just get a sense of the customer service available to you. Certainly, as a practice choosing a vendor, you want to make sure that you are introduced to the various aspects of the solution in an easy to understand way. Understand what it will take to get set up, how long it will take to get set up, what technical requirements are needed on your end. Understand, is your internet capability up to par for what they need for their solution to run well? Understand what kind of customer service you can expect to receive um, for troubleshooting, for example, for your practice end of the platform, as well as maybe for your patients. Are they available to patients to help patients get ready to roll on the platform? Ask about HIPAA compliance. If you're going to pay for a vendor, I think it's obvious that you want to make sure you've chosen a HIPAA compliant vendor. Ask for a BAA with your vendor to make sure that they further join with you in taking responsibility for security and privacy with the patient interactions. And finally, but very importantly, ask about the cost structure. How are you going to be paying for the use of this platform? You do need to factor that into expenses. You will be hopefully cutting down on traditional overhead expenses, such as rent or perhaps the cost of staff if you're converting a substantial chunk of your patient interactions to telemedicine. You want to make sure, though, that the cost of that platform is the balance of it's in your benefit, of course, for your practice. A final good question to ask is around integration with your existing electronic health record. Is it feasible with the platform that you're about to choose? There are some that are naturally built into your electronic health record, some that need some connection. And so learn the facts about that and the realities of the ease of doing that.
Okay, great. This is the last question for this episode. Are there any other things that we haven't discussed about getting started with telehealth that you think it's important for physicians to know and pay attention to?
I think the biggest misconception or series of misconceptions that they, if they haven't already realized that they can get over is that, number one, that there is not much patient demand for it. I don't think that's true anymore at all. And two, that the technical hurdles are insurmountable. I think we're finding rapidly that that's also not the case. And I think the final one is that reimbursement lags. And so this is not something I want to jump into just yet. As we know, at least certainly now during the public health emergency, that it's become necessary for many practices to make the jump in order to continue to have a stream of revenue, and that many payers have indeed relaxed and extended the types of visits that they reimburse. So all I can say is it's an unfortunate time to find ourselves in a pandemic situation, but we shouldn't lose connection to our patients, and we should jump in and use telemedicine to do so.
Dr. Salam, thanks very much for joining us today.
My pleasure. Thank you.
Thank you.